My name is Laith Al-Shihabi. I'm an orthopedic surgeon, hand and upper extremity specialist at Orthopaedic Associates of Wisconsin. My focus is hand and upper extremity surgery, which generally means anywhere from the fingertips on up to the shoulder. Most of my practice in specific tends to focus on the shoulder on down and problems that relate to that. In terms of age ranges, we treat anywhere from children to old adults as well. Well, I think what really makes this practice is the people that are a part of it, both from top down in terms of the physicians that are here. I think all throughout the group, I feel very comfortable referring patients that I've seen to other doctors within the group, and I think that everyone legitimately tries to do the best by their patients, and I think that's very important. And then going forward from that, I think the staff is exceptional here. At every point that I've worked with people here, whether it's the nurses, the MAs, the secretaries, I think all do an exceptional job, and there's a great workplace culture here. We don't like you having to wait when you're in the waiting room. Here in the surgery center, we try and keep it run as efficiently as we can, but at the same time devote as much time as we can to patients and not make them feel rushed either. And I think that there's not a lot of wasted time in the day, and that allows us to accomplish both of those goals. One of the things that I found that people are afraid of with surgery is not necessarily the surgery, it's the anesthesia and the idea that you're going to be out and not aware of what's going on. We've found that are able to do a lot of those same surgeries that before may have required heavy sedation under just a light local anesthetic and still be pain-free. I have yet to have a patient that tells me that they regret doing a surgery under local. Usually it's very well received and takes away a lot of the anxiety once you're done, because you realize that you're not being put under, you're not exposed to a lot of the risks of heavier anesthetic and sedation, and I think that has been a very big changing aspect of the way that surgery is done within hand surgery over the course of the last couple of years. There isn't the right answer for everybody for a given problem, but it's generally pretty easy to understand how, placed in their situation, you would want yourself to be treated, and I try and accomplish the same goals. I'm generally very conservative in my surgical indications, meaning that I'll only want to operate if I know that we have a good chance of making the problem better, and if we can't, then we'll treat it non-surgically. So I think that that personally is the way that I would want to be treated, were I in a position of being a patient, and so that's kind of the underlying way that I treat my patients as well.